Hi, this is Dr. Ken Mewich. Dr. Ken, most people know me by from the Fibromyalgia Wellness Center. And I'm still traveling, doing work with other doctors and also training and working with patients on our fibromyalgia protocol. And I'm very, very happy to say that we're doing exceptionally well working with each of these individuals and also groups. You know, it's very, very interesting. This is my 23rd actual live video, and we've got a number of people that are following us, and I do hope others of you will not be afraid to make comments and send information in. I'm trying to get back to each and every one of you as often as I can and as quickly as I can. By the way, for the patient that requested information whether or not adenosine triphosphate ATP would be good as far as a treatment is concerned. Of course, anything that might boost your fatigue factor or reduce the fatigue factor and improve it, that's the most important thing. Adenosine triphosphate ATP is produced by mitochondria, which are the batteries in your body, the ever-ready batteries. And so when we do anything, you don't have to do anything. If you're even asleep, the adenosine triphosphate is working on all of your organs, your skin, everything in your brain, so forth and so on. So you just don't have a cell that produces adenosine triphosphate. Each and every one of your cells in your body, the trillions and trillions of them, produce adenosine triphosphate. And when it's not functioning properly, it not only can cause a great deal of fatigue, but also makes you open to a lot of other conditions because it weakens your immune system. But I've had a number of people request information on this. They say, okay, so you're saying your protocol works so well. We've been working on it over 30 years. So what makes it so successful? What makes it that fibromyalgia patients are able for decades to actually be successful? Well, actually, it all started in, about 1990 when I received a phone call. For those people that you know about this, have read the book and so forth, I won't spend too much time, but I was asked to testify in a court case. Previous patient I had seen about a year earlier had gotten an automobile accident, and from that it triggered a high level of symptoms in fibromyalgia, which is very, very common. As I mentioned, fibromyalgia is triggered by some physical, emotional, chemical trauma. We have to understand that fibromyalgia, you are born with it because of the genetic workup of your cellular structure. Anyway, bottom line is that I had to testify. I used, at that time, I was very, very fortunate. The American College of Rheumatology actually brought out the first paper on fibromyalgia, and I used that to testify in court case. And the patient, who was like 19, 20 years old at the time, actually received the largest settlement in the history of a fibromyalgia, soft tissue case, $125,000 that she received for that. And from that, I started receiving a number of fibromyalgia patients or pseudo-fibromyalgia patients or patients that were worried whether or not they had fibromyalgia. And so what I did was I used the information off of that paper to help them. But the only thing I had on hand was what I was actually licensed with. I'm licensed in chiropractic, physical therapy modalities, acupuncture, cold laser, a variety of different things that I'm actually certified in that I can use on patients. But although it helped a little bit, it really never really got to the point where I was able to help patients to get them back to a normal state. A normal state is where you're pain-free and able to do things without having to worry about whether or not you're going to be able to wake up without pain or some other symptom the next day. And so to be honest with you, I have a lot of pride in what I do, working with patients. And so what I was going to do is give up and just tell the patients, look, I can work with you what I have, but I'm not really helping you with your fibromyalgia condition or situation. And so what happened was about ready to and I'm sorry to say, be honest with the patients and tell them that that was as far as I could go. And instead, two things happened in the year 2000, literally within a month or two of each other. The first one was actually a headline case in our newspaper where a 30-year young female with two children and a husband was going from doctor to doctor and emergency room to emergency room for pain and symptoms that were all over her body, and nobody seemed to be able to help her. And then what they did is they turned against her and decided shooing her out because they thought she was just in for the drugs. And so, and they're trying to send her to a psychiatrist, the old "it's all in your head" thing. And so what happened was one morning she had it, and so she made lunch and breakfast for the kids and her husband and sent them off, and then went out to a near freeway near where she lived in Phoenix, and she walked in front of a truck and left a letter behind saying that I'm not crazy, I'm in pain, and nobody wants to help me, and so because of that, I'm going to give up. And please, understand why I'm doing this. I was heartbroken. I couldn't believe. I've been working with fibromyalgia patients for a number of years, and I couldn't believe that this condition would be that severe and that debilitating and that emotional that patients would just pull the plug on themselves and literally commit suicide. And so many wonderful, wonderful people are doing this right now in various professions. Suicide is becoming more and more of a problem, and so consequently, this at that time, back in 2000, bothered me to recognize the fact that a group of patients that had a difficult condition that allopaths, MDs, DOs, so forth, would not accept as a condition, and so they were just sending them out to psychiatrists to literally drug them up. And so all of a sudden I got a boost and said, somebody's got to help these people. I mean, someone has to help fibromyalgia patients and not let them suffer. About a month later, I received a 3x5 postcard, 1990 or 2000. Those are still in evidence. And I received it from a doctor in California for a conference that they were holding in Phoenix, a fibromyalgia conference to explain what he did, so forth and so on. The name of the doctor is Dr. R. Paul Saint Amand, and he is head of Fibromyalgia Research Center in California. And he, along with his assistant, Claudia Merrick, an RN, and both of them have fibromyalgia. Both of them use the same protocol he developed. And he found that there was a genetic marker that was triggered by some, again, physical, emotional, chemical trauma. Although most of the patients that I see that come in, I ask them, how long have you had it? These symptoms and condition, and a lot of people will say, well, I think I've had it since childhood, but every time I go to a doctor, the doctor would say it was growing pains. Well, now I'm 40, now I'm 50, so forth, and I don't think I'm growing anymore. And so that's why one of the things that with fibromyalgia, it mimics so many other conditions, and it's totally misdiagnosed in so many conditions and areas. But anyway, so I went to his conference, and I talked to, it was attended by almost 3,000 people, of which about a third were patients and the rest were health providers, everything from MDs and DOs to chiropractors and nurses and so forth, so on. And what he was doing is actually training people in his protocol if they would be interested in going back working with the fibromyalgia patients. Well, I was so taken by this that I literally attached myself onto the doctor and the nurse, and they trained me, and so I've been working with fibromyalgia patients ever since. But I took it home. I started working with it with my patients, and I found it was wanting in some respects. And the wanting was that all of the fibromyalgia patients had high levels of inflammation, and many of them, most of them, had what I would call hypoglycemia, but how could I help these patients? And so what I did was I actually devised a pre-protocol where we actually use a anti-inflammatory gentle detox to remove a lot of the inflammatory materials out of their system and to control the inflammatory things that they constantly were ingesting food-wise. Like there's so many things in our diet that are bad, really, but the primary ones for most people are sugar, gluten, trans fatty acids, and dairy. Is that true for all of those products? No, but we took patients off of all of those for about 2.5 weeks, and then we started adding them on one every 72 hours, as I mentioned before, to find out whether or not there was a reaction. And the patients started responding very quickly because we took that secondary thing that was really limiting their body's ability to respond quickly to the therapy. And then after that, what we went and started was the actual protocol, which is the guaifenesin protocol that pulls the excess phosphate and calcium out of the cells patients urinated out. So my heart has been taken up by these fibromyalgia patients, many of which are so misdiagnosed. I mean, I've mentioned before in some other live videos about patients taking all these different medications, and they sometimes they conflict. They're going to two, three, four different doctors, and even though the doctors should know better, it's almost like a dart game. Well, let's see what happens if I give them this one. Let's see what happens if I give them that one. They have no idea how to treat fibromyalgia. They really do not. Ours works, but you have to treat it like I always tell, like another condition or like diabetes. If you cheat, you're going to fail. You've got to stay on the protocol. The protocol really involves taking the guaifenesin and staying off of what we call salicylates. Salicylates are plant-based. Now, you can eat anything that you want that's plant-based, okay? Because the liver will actually detox it and not let it go through your system so it adversely affects you. But the supplements, anything that has plant-based, you can't take those, okay? Regardless of how much you love a certain supplement, nutritional supplement or vitamin, if it's plant-based and it'll say on a bottle, supplement. Don't take it, okay? Or all the different things that you can put on your skin, especially for ladies, all the cosmetics. If you read the labels, most of them have plant-based articles or items in them, and the body absorbs that immediately. Man, it goes right in and adversely affects your body's ability to heal. And so, on the other hand, unbeknownst to a lot of people, Dr. Saint Amand has contacted so many of the cosmetic companies, and almost every cosmetic company produces salicylate-free products. That's no plants in them, no plants that would adversely affect you. You just have to ask for them, okay? Or you go on Dr. Saint Amand's website, and he has lists and lists and lists of them, so forth. Mary Kay was the first company actually to produce salicylate-free products. Believe it or not, I'm not selling the products. Believe me, I'm just telling you it's a fact. Okay, that's what's happening. So. I think it's very, very important, and I always say this, patients' willingness to succeed has to be greater than their failure. Their willingness to succeed in this protocol has to be greater than their failure. And they need someone like myself and other doctors we are training to refuse to lose. In other words, I refuse to lose to fibromyalgia in the patient. We keep on digging and finding out secondary things they might be problematic with. And I've mentioned before, all fibro patients have other conditions, okay? Whether it might be chronic fatigue, MS, lupus, Lyme disease, hypothyroidism, hypoglycemia, rheumatoid arthritis, osteoarthritis. The list goes on and on. That's why so many doctors, as I mentioned before, have a difficult time diagnosing, because fibromyalgia has the same and many symptoms as many of these other conditions. And yet, all of the objective tests, that's the blood chems and urinalysis and CBCs and x-rays, MRIs, all come back negative for fibro. Now, it might connect for some of the conditions that they have, but nothing for fibro as of yet that is an objective test. And that's what allopaths actually look for, MDs and DOs, as far as positive signs, so they can put a diagnosis together. I work very, very hard with fibromyalgia patients and their conditions. Matter of fact, many times I've testified for their disability. I'll go to disability courts and I'll testify, and then after they're finished with testifying, the judge will call me over and say, would you please tell me a little bit more about fibromyalgia? I don't have the slightest idea what this is all about. And yet they are deciding disability for these patients, and they don't know about it. Okay, I'm like a teacher. They'll say, "Do you mind spending some time and educate us?" And I say, "Hey, listen, I'll come over and I'll talk to the judges and explain to them what it entails." So, unless a fibromyalgia patient has a secondary condition that falls under disability, chances of getting disability under fibromyalgia itself are minimal, to be honest with you, because I've seen patients be negated 2, 3, 4 times until we find a condition that actually falls under disability. I love working with fibromyalgia patients. It is a work of honor at my part to see a patient go through and become healthy, in that they can plan on something tomorrow and not worry about it. They're pain-free. They can become active. They can date. They can go to parties. They can do all sorts of activities, and we work their way through them. As I mentioned once before, however, and I might be going a little bit long on here, if you've had fibromyalgia for a number of years it might take you a year or so to get back into normal. What is normal is where you can do these activities, because as soon as you start feeling better, a lot of the patients do this. They start feeling better, and all of a sudden, you want to build a garage or paint the Sistine Chapel or something like this. You're going to injure yourself. The muscles in your tissue are not acclimated to that activity. So don't be surprised if you have a secondary strain or something on that. That might actually feel like fibromyalgia, but it's not. Hello, Lisa. I hope you're doing wonderful also, and thank you so very, very much for your questions. And I do hope my communication with you is helping. And Shelley and Sheila and Carolyn and all the wonderful people that partake in this, I want to thank you so very, very much. Keep the questions coming, and I'll try to answer them as soon as I possibly can. Again, this is Dr. Ken from the Fibromyalgia Wellness Center. I look forward to seeing you again next week. And let me know if there's a subject that I think that might be of pertinence. I think what I'm going to do is look at something called telomeres or telomeres that might be able to help fibromyalgia patients also. I think we're going to concentrate on that next week. So tell anybody that that has fibro or that might be interested in what I'm giving them. Also look at the my website, Fibro Wellness Center, where all 23 of these live videos are up, along with blogs themselves that I've done. I've done dozens and dozens of blogs on different subjects for fibromyalgia. And October 6th and 7th, we'll be training doctors in Phoenix, Scottsdale, at the Franciscan Renewal Center. If you've got a doctor that's interested, please have them check, because we'll be getting information out to them to join us for certified educational units in a 2-day affair, training health professionals to help fibromyalgia patients. Thank you so very, very much. And the happiest of 4th of July wishes. Be safe, especially if you're going to be on the road. So I was talking about something the other day, and somebody said, I can't believe how many people are injured with firecrackers. Well, rule number 1 is don't light one that's in your fingers, okay? Don't light one while you're holding a firecracker. That's where you have a serious problem. Anyway, take care, everybody. Enjoy themselves. Have a great time. And the happiest of 4th of Julys. Bye-bye now.